Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Tiara khalilah. I am a fourth semester student of Veterinary Medicine at University of Wijaya, Kusuma, Surabaya. Today, I would like to present the role of veterinary science in supporting sustainable urban development in Surabaya. So, in this topic is related to the Sustainable Development Goal is the SDGs, especially SDGs 3, good health and well-being, and then SDGs 11, sustainable cities and communities, and the last one is SDGs 15, life online. So, Surabaya is the large city in Indonesia with a population of than 2.8 million people. Rapid urbanization creates challenges in public health, environmental sanitation, and animal management. One of important issues in the increasing number of stray animals, especially cats and dogs in Surabaya. Stray animals are commonly found in market, residential areas, and food centers due to the availability of organic waste. So the city produces more than 1,600 tons of waste per day, which is support the survival of this animal. So uncontrolled breeding and abandonment of pets also contribute to this problem. Many people still lack awareness about responsible pet ownership, including sterilization and vaccination. So, in this condition, increasing the risk of zoonosis disease, which is disease transmitted from an animal to a human, such like rabies, toxoplasma, and then leptospirosis. Although Surabaya is the considered a rabies-free city, the rate still exists. Rabies is a fatal disease. Therefore, preventing is essential. The government has conducted thousands of free vaccines every year, but coverage still needs to be improved. So, from a veterinary perspective, this issue is not only about an animal health but also a public health and environmental sustainable veterinarians plays as an important role through three main actions. First is preventive healthcare, including like a vaccination, parasite control, and routine monitoring to prevent disease transmission. Second is the public education to increase awareness about responsible pet ownership, like hygiene and disease prevention. Third is population control through sterilization programs which are effective in reducing the number of stray animals. In Surabaya, these efforts have been implemented but still requires stronger collaboration between government veterinarians and the community. This approach is known as One Health, which highlights the animal and environmental health by applying One Health Surabaya can improve more public health, reduce disease risk, and create a more sustainable effort environment from an environment perspective. Uncontrolled animal population and disturbed ecosystem affect biodiversity. Therefore, veterinary investment also support environmental sustainability. To conclude, veterinary medicine has strategic role in building a sustainable city by improving animal health. We also protect human health and the environment. As a future veterinarian, I believe our responsibility is not to treat animal but also to protect public health and supporting sustainable development. Because a sustainable city is a city where humans, animal, and environment live in harmony. Thank you for the attention. Wassalamualaikum warahmatullahi wabarakatuh.